Here we're looking at the muscles of the lower limb, and I'm showing you this view because as we move through this video, I will remove this model from the stand and lay it on the table. So here you're looking at your inguinal ligament. This is your iliac bone. That's the iliac crest, just for orientation. Femoral vein, artery, and nerve. This is your thigh, your knee, and this is the leg, and of course the foot. Now what you're seeing here is an anterior view. Here we're looking at a posterior view. So of course your gluteal group, your hamstrings, these are your calf muscles, right? Your heel bone, your calcaneus. This is a medial view. So this would be the medial aspect of your thigh and your leg. This is your big toe right here. So this is all a medial view. Finally, this is a lateral view. So again, your gluteal muscles from a lateral view, your IT band, gastrocnemius, and of course your heel and your toes. So now I'll take this model out of its stand, lay it down, and we'll look at the muscles up close and go through some of the naming. So now taking a closer look at these muscles as we name them, orient yourselves when you're looking at this because it's no longer vertical, it's laying down now. So here's your inguinal ligament again, your iliac crest of your iliac bone. So this is the pelvic region right here. This is the femoral region or the thigh. And then the leg is distal to that. The muscle group you see right here are the quadriceps, at least 3 of the 4. So this is your rectus femoris, and it's a hip flexor as well as a leg extender because it crosses both the hip joint and the knee joint. This is the vastus lateralis and the vastus medialis. Let the big toe be your roadmap. So the big toe we know is more medial. It's on this aspect. So this is your vastus medialis, and of course the lateral one would be the lateralis. The quadricep you cannot see here is the vastus intermedius. Inter means between. So it is between the medialis and the lateralis and deep to the rectus femoris. If we look at this muscle right here, this is called your tensor fascia lata. It's coming off this iliac crest and anterior superior iliac spine of the ilium, and it inserts into this white tissue known as your IT band or your iliotibial tract because it starts from the iliac crest and goes all the way down to our tibial bone, the IT band. This is a tendinous sheath that helps to stabilize the leg. It often becomes irritated in long distance runners. So the IT band. If we look at this muscle right here, this is your sartorius, this big strap muscle. Now this is the longest muscle in your body. It is also one of the hip flexors because it too crosses the hip joint. And while we're on the subject of hip flexors, let's look at these two. They collectively make up the iliopsoas group. This is your psoas major, and this is your iliacus, coming off this iliac bone. So the iliopsoas group, and they become tightly bound together down here below the inguinal ligament. But again, they're hip flexors. If we move towards the medial aspect of this thigh, you'll see this group right here. There's a strap muscle and then these 2 big muscles here. These are adductors. So they function to adduct the leg. In other words, pull it toward the midline of the body. You have your adductor longus, your gracilis, and your adductor magnus. And remember, this is anterior, this is posterior, this is medial, just to make sure you know what view you're looking at. If we rotate this even more to the posterior now, you're going to see your hamstring group. And these are antagonistic to the quadriceps. So this lateral group right here is the biceps femoris. And again, there are 2 heads, right? A short head right here and a long head here, biceps femoris. Don't confuse this with the short head. This is actually part of your vastus lateralis. So biceps femoris group. And then you have your semitendinosus and membranosis. Now, the tendinosus is like a tendon. It's cord-like right here. And you can follow it all the way down without ever breaking contact with its tendon. The membranosus is flatter and wider like a membrane. And although it's deep to the semitendinosus, you can see the membranosus here and you can see it here. It's wider than the tendinosus, so you can see it on both sides, at least at this distal aspect. Up here, you wouldn't be able to see it like that. If we slide this a little more into view, now we're looking at the gluteal group. This is your Gluteus Maximus and your Gluteus Medius. There's one more gluteal muscle called the Gluteus Minimus. It's deep right about here, so you can't see it in this model. If we slide this down, now come down to the leg portion below the knee, right? So just a quick orientation here. This is anterior view. This is your patella or your kneecap. This is your patellar ligament. Right here, you have the tibial bone. This is your tibia. This is the weight supporting bone in your lower leg. On the front of the tibia, or the anterior of the tibia, is this muscle called the anterior tibialis or tibialis anterior. Next to that, more lateral to that I should say, is your extensor digitorum. Now again, anytime you hear digitorum as part of the name of a muscle, you know that it's going to be giving off multiple tendons going to the digits, whether they be toes or fingers. Digits are digits. So this is your extensor digitorum. And the leg is opposite that of the arm in terms of flexion and extension. In the arm, the anterior muscle groups are the flexors and the posterior are the extenders. Here, the anterior muscle groups are the extensor muscles and the posteriors are the flexors. Go lateral to the extensor digitorum and we have this fibularis group. So this is your fibularis longus, long tendon. And right here, again, here and here, you can see the fibularis brevis with a short tendon. And that's your lateral malleolus, part of the fibular bone. Remember, the fibula is more lateral. Finally, if we rotate to the posterior, you can see the gastrocnemius group, or what we commonly call the calf muscles, right here. And you have both a lateral and medial head, and again, let the big toe be your roadmap. Big toe is more medial, so this is your medial head of the gastrocs, this is your lateral head. And then this big muscle you can see right here, it starts out deep to the gastrocnemius group here, but as it extends, it becomes more distal too. You can see it here and here. It's a big wide muscle and it's actually synergistic. It helps the gastroc muscles flex at the same time and pull on this calcaneal tendon, which causes us to stand on our toes. So that's your calcaneal tendon. It is a combination of the tendinous extensions of the gastrocs and the soleus. Two more muscles to look at here. They are both flexors. Right here, the more medially located one is the Flexor Digitorum Longus. Now this one little muscle, even though it's medial, will send tendons out to the lateral 4 digits of the foot for curling those toes. Next to that, you have this one right here is the Flexor Hallucis Longus, and that's going to go directly to the big toe for curling the big toe. So those are the muscles of your lower limb.